So we hear from a lot of people who are dealing with smell or taste disturbances where they just have lost their sense of taste or their sense of smell. And these often go hand in hand. A lot of people feel like it's this loss of smell that can affect your tasting procedures. So I view this as an issue that really needs to be corrected. Like if you have a gas leak in your house, how would you know? You don't have the ability to smell that. When you're eating, if you don't have a sense of taste, it's almost like you need to eat with somebody. Hey, can you taste this fish and let me know if I'm going to be sitting on the toilet for the next 3 weeks? I've talked in other videos how I feel like it was a food poisoning issue that led to me losing my voice for 8 years. So I'm really not a huge fan of food poisoning. So this could be an issue that could be very important for a person to improve. So in this video, I'm going to help you understand the most common underlying causes and why addressing those causes doesn't always work for everybody, and steps you can take to improve the situation. Let's jump in.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So remember, I'm not a doctor, I'm not giving anybody medical advice here, but I'm going to share some medical studies in this video that'll help you understand the most common underlying issues, and I'll put links to those studies in the description below this video so you can dig deeper if you like to. Now, first of all, it's possible for issues like some type of head, face, or brain trauma or injury to be able to affect our ability to smell and therefore our ability to taste as well. If we damage that whole olfactory system that's responsible for helping us smell and taste correctly, that can cause problems. So that certainly is a possibility when we're looking at this loss of smell or taste. We hear a lot about people dealing with infections, and there was a very popular cold that came about a few years ago where a lot of people lost their sense of smell and taste, and some of them still have not recovered that, and we'll talk about that a little bit. But what's really important when we're looking at the ability to smell and taste, our minerals are needed in the body, and most specifically, a very important one is zinc. And zinc helps us have that ability to smell and taste, but the body also uses zinc for a lot of other functions in the body. The body needs zinc to make this hydrochloric acid in the stomach so that we can digest our food and break that down correctly and get nutrients out of that food. But the body also uses zinc for the immune system a lot. So let's look at some of these studies, and we see here with this study on zinc and taste and smell disorders, they say that the study provides the statistical results of clinical tests conducted on 1,500 cases whose main complaints consisted of taste disorder. It was verified through zinc administration treatment and animal experiments that a major part of these cases were disorder on the taste bud level and that they were caused by zinc deficiency. We also obtained evidence that zinc deficiency can cause smell disorder in some cases of olfactory epithelium disorders. Cause of taste and smell disorders triggered by zinc deficiencies continue to increase. The main causes are unbalanced diet, food additives, and drug intake. So it feels like they're in this study, they're saying that they feel like a lot of people can lose the ability to assimilate that zinc. Maybe some medications have the ability to block that. The diet that we're eating today just doesn't have the level of minerals and nutrients in it that it used to, and a lot of food additives seem to block the ability for us to assimilate a lot of those nutrients. In this study here, in the efficacy of normalizing serum zinc level for patients with olfactory dysfunction and zinc deficiency, they say in a previous study, zinc deficiency exacerbated the severity of olfactory dysfunction. The results of the present study suggest that it may be difficult for patients with olfactory dysfunction to improve their olfactory function if zinc deficiency remained even after treatment. So in this study, they're talking about people that may have had some type of brain trauma or some type of injury that was affecting their ability to smell or taste, and that when they were using treatments to try to improve that issue, the treatments that often worked for those types of injuries didn't help if the person continued to have a zinc deficiency. So this really helps us understand that this zinc deficiency is a very common issue when we're looking at this inability to smell or taste. And when we're talking about this immune system function, the body needs to use zinc for that immune system to function correctly. So if a really aggressive bug gets in the body, like we have this popular cold a while ago, when a really aggressive bug gets in the body, then the immune system has to do more action to take care of that. It might need more resources, and it seemed to have the ability to really suck up a lot of the body's zinc and use it up, especially if the person was having a harder time bringing it in. So one person may have been fine where another person loses their sense of smell and loss of taste because they didn't have enough zinc in the system to withstand that requirement for an increase of zinc usage. Does that make sense? So if somebody has a reason why they're not assimilating zinc as much, then they may have a problem a lot earlier and a lot longer than someone else may have that issue. Or maybe the person already had some type of chronic infection or digestive overgrowth where the immune system was already overly active dealing with this infection and using up all the zinc, and then some other thing came along and took the whole thing up a few notches. Let's look at this study here on zinc nutritional status, mood states, and quality of life in diarrhea predominant irritable bowel syndrome. In this present study, serum zinc is hard to say. Try to say that 3 or 4 times. I just took like 7 takes trying to say serum zinc. Serum zinc levels overall, physical and psychological health were lower, and scores of depression, anxiety, and stress were higher in IBS-D patients. In addition, higher dietary intake of zinc correlated with improvements in psychological health and body image in the control cases respectively. So what they're saying is when we're looking at this IBS-D, which is a diarrhea situation, a chronic diarrhea problem, that they saw higher levels of zinc deficiency issues. And what we see with our patients is that it's very important to be able to bring minerals in for that digestive system to be functioning correctly. So if someone's dealing with a chronic diarrhea issue, well, everything's kind of screaming through the system. There's no time to really assimilate all the nutrients in whatever you just ate because it's shooting out the back door and lifting you off the toilet like a rocket. So this is a magnification of a digestive malfunction when we're looking at an IBS-D issue. But that doesn't mean that a person has to have IBS-D or a chronic diarrhea problem to have trouble assimilating minerals. So when we're looking at supplementing with minerals, because a lot of people will say, oh yeah, I've heard that this loss of taste and smell can be about a zinc deficiency. So I'm going to supplement with some zinc, and wow, that did nothing for me. Well, we need to be able to assimilate those minerals. Now, if you're supplementing with vitamins or amino acids, you can take those away from food and they go into the system pretty easily. But if a person's going to supplement with minerals, they need to take those minerals with food because you need that digestive action going on to be able to assimilate those minerals. So this also helps us understand why some people have such severe mineral deficiencies even though they're consuming foods that contain these minerals. Well, we need to be able to break that food down, and it's very common for someone not to be making enough stomach acid to acidify that food correctly. Then this bile that's stored in the gallbladder that's supposed to come down and help us emulsify our dietary fats. It helps with the neutralizing the acids that leave the stomach along with this bicarb that comes from the pancreas. And it helps us access fat-soluble vitamins like A, E, D, and K. All those things are really important. So we need both sides of digestion working correctly to be able to break the food down enough to assimilate the minerals and the nutrients in that food. Another thing that we see is we also see problems with zinc deficiency when there's a dysbiosis in the microbiome. So we're supposed to have these good bacteria in our gut, in the large intestine here, that kind of help us assimilate a lot of our nutrients. The action that they do when they're breaking these things down further helps us get more nutrients out of that. So we see a lot of mineral and nutrient deficiencies when there's a lot of bad guys in there that have kind of taken over the camp and pushing the good guys around. So not only do the digestive functions need to be there, but we need to have a good gut flora to really be able to assimilate those minerals. So if a person's dealing with any digestive symptoms at all, that's a sign that there's a malfunction somewhere in this digestive system that could restrict your ability to bring these minerals into the system and allow the body to have all the nutrients it needs to function correctly. You can even find like zinc testing kits where you're basically just taking a zinc liquid mineral and you put a couple teaspoons in your mouth and you hold it there for like 10 seconds. And if you don't really taste anything, like it's a neutral taste or it's even like a kind of a good, like a sweet taste a little bit, they say that that can be a sign that you need to take more zinc. Where if you taste like it's unpleasant, then that's your body saying, I have enough of this, I don't really need it. So this is not a diagnostic thing for certain, but for a long time, people have been having trouble assimilating this zinc mineral that the body really needs for a lot of functions. And something that's really interesting is that, remember, the body needs zinc to make this hydrochloric acid. So if you don't have enough hydrochloric acid to really acidify your food, you can't get all the minerals out of the food that you're eating. And then your body doesn't have the minerals that it needs to make the hydrochloric acid. So a person can get stuck in this broken cycle of digestion for years or decades. So what we like to see clients do is if they have digestive malfunctions, they need to correct those. But then you might also want to supplement with some zinc while you're working on improving any of these dysfunctions. And I'm not going to give you a brand or even a type of zinc. You know, we use zinc picolinate a lot because that seems to be the closest to what the body really needs to be able to make hydrochloric acid. But I've seen clients improve smell and taste issues using like zinc chelate and other forms of zinc as well. So it's really going to vary from person to person. But again, it's not just a matter of supplementing with zinc and yay, I'm going to fix it. That was easy, take a pill, I'll just move on with eating all this junk and not worrying about my health. Sometimes more effort needs to go into that. You might need to improve these digestive malfunctions so that you can assimilate the zinc that you're bringing into the system. So if you're new to this channel and you don't know how to improve digestive issues, we have a totally free digestion course that kind of walks you through figuring out which aspects of digestion are not working correctly and what steps can you take to improve those issues. And I'll put a link to that totally free course in the description below. And right now, if you're not even sure if you're dealing with mineral deficiencies or how your levels are doing in your body, you can jump over and check out our video on Am I Dealing with an Electrolyte Deficiency, so you can get signs and signals that maybe that's a problem you can improve. I can't wait to hear about your results.